everyone. Thank you for joining another episode as I talk all things Black women health. Now, I want to start off by providing a little bit information about me, and then I'm going to go into 5 barriers that Black women experience that causes them to have unhealthy or unsuccessful health journeys. Now, my story began with my pregnancy. My very first pregnancy, I had a miscarriage, and I was so dumbfounded because I was just like, I eat healthy, I work out, I make sure to rest and take care of myself. I didn't understand how I lost my baby. So that caused me to do a little bit more research on maternal health and essentially Black women's health so that I know that I could do better the next time I did get pregnant. Now, I got pregnant again, and this one was a little bit different for me. The outcome was a scary one. So, as I mentioned, because of my miscarriage, with this next pregnancy, I wanted to make sure that I dotted all my I's, I crossed all my T's. I was not going to lose another baby. So, I had a healthy pregnancy, but towards my, I'm going to say probably second trimester, I started to have floaters. Now, if you're not familiar with floaters, those are like little silver dots that you see associated with having crazy migraines. And I brought this to my OBGYN's attention, and she said, "Hey, you're fine. You're healthy. You're young." I was 28. You're healthy. You're young. You're probably experiencing this because you're working in a healthcare space. You're on your feet. You're working a lot, even though I only work 3 days a week. So I said, you know what? She's the expert. I'm going to trust her. That was that was problem number one. So as I get to the labor and delivery, I deliver my baby, everything was fine. But exactly 9 minutes later, I had the worst migraine I could ever experience and that I ever experienced. And I couldn't open my eyes. So I'm in fear, I'm in panic mode. I'm like, I don't know what to do. I'm telling my husband, I'm like, I can't open my eyes. My head hurts. So he went to go get the nurse. The nurse came in, white lady, and she was nice, but then she just kept asking me questions. And I'm like, ma'am, all I know right now is that I can't open my eyes and I feel like my head is about to explode. So as she continued to try to figure out what was going on, I instructed that maybe she needed to bring somebody else in here before something happens to me. So she took my blood pressure, and this is probably about 10 minutes later. She took my blood pressure, and the blood pressure went up to 180 over, I think it's like 96. It was something so ridiculous. And she automatically had the tech and all the healthcare support to come in to set me up on a magnesium drip to prevent me from having a seizure. Now, let's go back a little bit because I indicated to my OBGYN that I was seeing little dots. That's what I said to her. I said, I'm seeing little dots, which I later found out that they're called floaters, and I have really bad migraines. Those are two symptoms of preeclampsia. One large indicator of preeclampsia that a lot of healthcare professionals really tag is protein in your urine, but I didn't have that. So that's why she ignored my request of being able to further investigate why I was having these symptoms. So when it came down to, not going back to my delivery, when it came down to like, okay, I'm recovering, I had to get admitted, they told me I was experiencing delayed preeclampsia. Now, I always go back and forth with myself, like, could this have been prevented if my OBGYN would have just listened to me? Just because I didn't have that one indicator of protein in my urine, but I had two, she ignored how I was feeling and the complaints I was bringing to her. So you say, I told myself, you know what? You're healthy, you're here, you're okay, your baby is safe. I continue to go on with life. Now going to my second pregnancy. This was at the very beginning of COVID, when COVID really started to like take over in April 2020. That's when I actually had my second baby. And I was already in a panic. I worked in the healthcare space. So I was every day, every night working in a hospital. Of course, I was protecting myself, but I knew the severity of what was happening in the pandemic. But when it came down to actually delivering my baby, it just took it to like the next level. I had to wear a mask as I was delivering. My husband couldn't come back until they actually saw that I was in labor, but my water broke as I was walking in. So it was a traumatic experience just kind of going in. So my OB wasn't on call. I had another OBGYN, a white physician, white lady physician, and she was nice. She was, I guess, trying to make light of what was happening, the fact that I was giving birth during the beginning of the pandemic. So as we're kind of going through the wait for my son's arrival, he didn't want to come down. So she put me in different positions, switched me around, saved the details. But I guess, again, to make light of what was happening, she asked me what was my son's name. And I told her Ethan. And she said, "Oh, he doesn't want to come down because you gave him a white boy name." Now, this was straight up racism. I never knew name had a color, but for you to tell me in a vulnerable state, in a vulnerable situation, that my son did not want to come down and I'm being flipped in all these different positions is because I gave him a white boy name. And continue to say that I gave my older son a white boy name and that she's hoping that my son come down because she want to go back to watch football with her sons, her kids. In my mind, I wanted to say all the things, but I said, you know what? I worried more about my health and my baby's health. So I stepped back and I didn't say anything and I just looked at her. Of course, I didn't have any medicine at this time. Delivered my baby. I started to have chest pains. She said, if a Black woman tell you that she has chest pain, you cannot ignore it. So when she made that comment to me, I told her, I said, there's things that are appropriate to say and not appropriate to say. And I need you for never to say that to me or any other Black woman again. Mind you, I'm highly educated, degrees from Spelman College, Baylor University, certifications. And she felt like I don't care about any of that stuff. I'm a provider. Maybe I'm a white woman. I don't know. But she felt like she can say whatever she wanted to say to me until I checked her respectfully. I tell you this story because I don't just preach or educate based off my professional background. I tell you these stories because I personally went through systematic and interpersonal racism through two of four of my pregnancies. Now, that brings me to what I really want to address today. 5 barriers that Black women experience when it comes down to maternal mental health and just chronic diseases and maternal mortality in general. So, the first one I want to address is systematic and interpersonal racism. When I talk about systematic racism, it's the way that Black people, women and men, birthing people, or just people in general, how we are experienced and how we're treated through the healthcare system. And this is a rising issue. This is something that we already know, but we're still in the works of trying to fix the resources that are unaccessible to us, the way that medical providers or just healthcare professionals address us and treat us when we're coming to them in vulnerable states. Systematic racism is something that goes back so many years, and the ways that we can really combat that is being able to build relationships with providers that we can actually trust and providers that will listen to us. Another way that we can combat systematic racism is being able to put more of us or more Black and brown people into the healthcare space. It's been proven that we will trust the healthcare system, which will go to my second one. Research shows that we will trust the healthcare system when we see somebody that looks just like us because we know that they will really listen to us and cater to our needs in whatever situation that we're going through. So, as I mentioned, that goes to number two as distrust in the healthcare system. Now, this go back all the way to the Tuskegee experiment, where a lot of our ancestors, a lot of our families were being tested on, they was being experimented on being mistreated. And this is something that we hold near and dear to our heart as a Black and Brown community that causes us to distrust the system, how they treat us, how they don't listen to us when we say the things that we needing or the things that we're feeling, or maybe because of our background, they don't believe what we're bringing to them is truth. And it's maybe that we may just be seeking drugs or whatever the case may be. There's distrust in the healthcare system. And to combat that, to change that, is be able to, again, build relationships with healthcare providers, more of us getting to the healthcare system, as well as connecting with our community and community leaders. It's a lot of us that's in public health and community health that are bridging that gap between what is needed in the healthcare system and what and within the Black and Brown community. So connecting with a community leader, telling them what you're going through, looking at community resources on how to get education on diabetes, for example, cerebral palsy, whatever you may be going through, mental health, maternal health, whatever you're going through, educate yourself. So, where you can build the confidence to get into the healthcare system, if you encounter somebody that does not look like you, to be able to advocate and speak up. The next one is shame and stigma. Now, we know in the Black and Brown community, we do not want to seem weak. We do not want to ask for help. And sometimes that causes larger barriers than what we think. So we have to change the mindset of our culture. We have to understand it's okay to ask for help. It's okay to be weak, because if we don't express how we feel, we continue to bottle that up. We continue to keep it to ourselves, and that causes barriers. And that can sometimes cause us to lose our lives. So let's change the focus. Let's change the conversation to promote and create healthy relationships around being able to say, hey, I need help. I'm experiencing this. I don't know what to do. I'm feeling really vulnerable right now, even as a Black woman. And this also goes for my Black men. The next one is logistical barriers. Now, I know a lot of us in the Black and Brown community, we work 3 jobs. We use public transportation to try to survive life, depending on our social economic status. Logistical barriers sometimes, and most of the time, causes barriers in for us to be able to get quality healthcare or even just to be seen. And I'm gonna be honest, I am a victim to this as well. Sometimes I'm so much on the go and trying to do things for my family that then I'm like, oh, Nishay, when the last time did you go to the doctor? When's the last time you got your check? Because we're trying to manage all the things, right? So let's really build a community. Let's bring a sisterhood to promote being able to take care of ourselves and to promote self-care and to be able to say, hey, I need to make sure that I'm taking care of myself, because I can't take care of you if I'm not full of what I need to do spiritually, emotionally, and physically. And the last thing is screening tools. Now, a lot of screening tools that the healthcare system use is based off our non-Hispanic white counterparts. So, um, we need to create systems, tools, screenings that is unbiased to the Black and Brown community. We need to be able to use stuff to diagnose or use strategies, use tools, use systems that can diagnose Black and Brown people not based off of our white counterpart. So these are the 5 things that I really wanted to bring up that, like I mentioned, I personally experienced myself that causes unhealthy outcomes or traumatic outcomes for Black women that's related to the healthcare system. Now, for each episode coming forward, I am going to talk about each of these 5 barriers in detail. So make sure to subscribe to this channel because you don't want to miss as I bring on experts and provide tips on how to combat these barriers as a Black woman.